Migraine pain. It is a neurological pain which is produced by the abnormal genes in the familial predisposition. Mostly this pain is unilateral, throbbing and pulsatile one and appear in episodes. It is not a continuous pain, but it cannot be cured. It can be managed by the proper change in the lifestyle and the necessary medicine for the treatment of and the management of this disabling headache. Mostly it is prevalent in the females due to the action of the estrogen hormone for the production of this abnormal voltage in the pain center of the brain. The diagnosis is absolutely depends on the history of the patient. The other physical examination can be performed by the healthcare providers. Mostly MRI and the CT scans are used to exclude the other pathologies, creating the various other types of headache in addition to the migraine. We can also detect tumor, vascular atheroma, then there is hematoma, bleeding, other pathologies which also produce the various type of headache in the human being in addition to the migraine pain. Now the main hallmarks or the red flag symptoms of this disease is it is always and mostly it is unilateral, throbbing, pulsatile and episodic pain associated with nausea, vomiting. Then there is dizziness, tinnitus, paresthesia, that is numbness and tingling. There is also flashes of light, disturbance in the visual field, that is zigzag lines appear in the vision. So these are the various main or the hallmarks diagnostic feature for the migraine pain. Now we come to the treatment. The treatment consists of two stages or two types. Acute treatment when the episode appears, so we provide analgesics, NSAID medicine, especially acetaminophen, ibuprofen, paroxysms. These are medicine to alleviate the pain symptoms. Then there are the antiemetics like metoclopramide, gravinate. These medicines are used to stop the vomiting and the nausea. Other medicine, they are the antidepressant and the anticonvulsant medicines. So these are also used for the treatment of the patient in acute phase. Then we come to the preventive treatment. Preventive treatment is a continuous one throughout the life. The aim and object of this treatment is to reduce the intensity and the recurrence of the migraine episodes. We try medicines, therapy to reduce the intensity and the recurrence or the severity of this severity and the recurrence and the of the episode appearance. We try to cut off the and prolong the interval between the episodes by the various medicine. Mostly triptan medicine, sumatriptan, rizatriptan, these are used in the form of pills, in the form of nasal spray and the shots, subcutaneous etc. So these medicines they are used throughout the life to reduce the recurrence and the severity of the headache. Other preventive measures that is you should avoid the trigger factors. That is flashes of light, loud noise, strong perfumes, diet factors. That is you should avoid excess of alcohol, caffeine, chocolate, processed meat and the foods. Then comes the stress which consists of physical and the psychological one. So in this we have to adjust the aerobic exercise up to the level that is safe for the patient. Over exercise that produces fatigue and also that is a trigger factor for the migraine pain. Psychotherapy is must to avoid the depression, anxiety, irritations, change in moods. So for that yoga exercises are advised. Healthy diet which consists of fresh food, fruit, vegetables, milk and the omega-3 rich diet that is walnut, pumpkin, flax seeds, salmon fish because the omega-3 is not synthesized, not manufactured within the human body. It has to be taken from outside and it is a necessity for the washing and the health of the vessels, whether it is coronary vessel, whether these are cerebral vessel, whether they are renal vessels. So these omega-3 is rich diet is advised. Moreover, calcium, vitamin D and vitamin K supplements, zinc supplement and also vitamin E. These are the iron, folic acid in the form of various supplements that should be provided to the patient for the physical and the psychological health of the patient one. So to avoid the migraine pain, patient should be provided and should be residing in dark, quiet rooms and should avoid the trigger factors, whether they are food ones, whether they are psychological ones. That is, there should be a atmosphere or the environment must be provided which is suitable for the migraine patient. For that, sufficient amount of water. That is, stay hydrated. Dehydration is also a trigger factor for the migraine pain. So these are the basic factors which are used in the preventive treatment and the preventive measures for the migraine patient.